Going to start the Littleton Board of Health Wednesday, November 4th Zoom meeting. Just to go over the Zoom rules is the town of Littleton began conducting remote participation Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns related to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to the board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of the comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated in the public record. In response to these concerns, the town of Littleton will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone. So that the meeting can occur in an orderly fashion, we ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you call in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, the participants should unmute, then state their name and address. And after speaking, we request that the participant return their microphone back to mute. So again, like all other of our meetings, we have some agenda items, some public hearings that we need to deal with right at the beginning regarding some variance requests. And so if the audience would refrain from raising their hand until, unless they have concerns regarding the public hearing, when they raise your hand when the item that you're interested in speaking about comes up. So it's 7 o'clock in the public hearing for 122 Greenfield Drive with Jonathan Markey requesting a variance. I think I saw Jonathan in the participants. Oh, hi.
Good evening.
Good evening. Anybody here from Louise?
I have not.
Okay, I just texted her. No answer. So we have a quorum, so we can go ahead. So, Mr. Markey, did you want to discuss with the board what the variance request you're requesting?
Sure. So this project actually was permitted about 7 years ago. I'm not sure if the variance that we're requesting was part of the Board of Health rules and regulations back then, but on the subsequent filing for the new permit, it came up that we need to seek a variance for the regulation regarding the distance of fill to property line. I'd like to iterate that the drainage in the area is actually one of the best drainage systems in the lake lots area. There are formal catch basins located at the intersection of Stowe Place and Colonial Drive. Greenfield Drive is actually a paper road at this point. It will be just a single driveway which accesses to that intersection of Stowe Road and Colonial. But there is a formal drainage system in that area. The lot is already gently sloping. It's generally flat, but it does slope from back to front.
Excuse me, Mr. Markey, do you have the ability to share your screen?
Sure.
So we can all see exactly what you're talking about?
Yeah. Okay. So as you can see, this is Colonial Drive here, and this is Stowe Place. The locus is this 16,000 square foot lot, by which of today's standards on a lake lot, that's actually a pretty decent sized lot. The project contains a proposed four-bedroom house with associated septic system located in here. Construction of the primary septic system does not require this variance. The variance is only required in the event that the future reserve area is to be built. So, you know, it's really just for the future use that we need the variance. And this would be years and years down the road. I'm sure the Board of Health regulations will change. Even Title V will likely change before we have to build that future reserve area. But nonetheless, we do need to request that variance. It's in my professional opinion, I don't believe that this construction of the house and the septic system will have any adverse impact on the existing drainage system in the vicinity of Stowe Road and Colonial Drive, given the infrastructure that's already present. It's, you know, that area is not really prone to flooding. The soils in the area are generally good. We had perk rates of 20 minutes an inch, which in this soil type is pretty normal. So with that being said, I'm requesting a variance to allow construction of only the reserve area for that variance.
And can you point out where,
The reserve is?
which corner you're talking about that you need the variance for?
Yeah, I'm going to show you a quick picture of, I'm actually going to share the screen with the AutoCAD file, and that kind of shows. Let me just turn something on. So again, this is the lot that we're talking about in blue, and these blue lines here are the existing grading. And well, actually, that's the proposed grading for our primary system.
I'm sorry, I don't see a thing. You just, apparently it's coming and going. Is that the idea? Are you sharing your screen?
Yep. Are you able to see there's like a black background?
No,
No.
I just see the black and white.
Oh, okay. Actually, I think I have to swap.
Yeah.
All right, hold on a second. Actually, so I'll just. All right, can you see my cursor on the screen?
Mm-hmm.
Okay. So the reserve area grading after construction, if ever needed, will come about 5 feet from this property line and come down like this to about 5 feet off of this property line. That's what the reserve grading will look like. But construction of the primary system does not require any grading within 10 feet of the property line.
Right.
And the reserve is supposed to be, what, we're supposed to be 15 feet off?
Your regulation says 10 feet.
10 feet.
And Title V, State Environmental Code says 5. So we meet State Environmental Code, but I don't meet Town of Littleton for the reserve.
Does the owner of parcel 121 know of your plan?
Yes, we sent out certified abutters notifications, certified return receipt. And I sent a letter to them stating that if they wish to view the plans, you know, I could email them to them. I heard nothing from them.
Any other board questions? Louise or Gino or Mike? Kevin, you're all set?
When he says reserve, what does he mean? That in the event that sewage treatment comes in through, what? Something like that? in case someday they need what?
Is that if the septic system fails, they'll have room for another one.
So,
We require that for new construction. So I assume this is new construction, Mr. Markey?
This is new construction, yes. So the reserve area is required for any new construction. You have to show that you have enough area available for,
emergency.
anticipated failure of the primary.
Why is designed like that? Would it be better if you have it sort of like line up with the land, like, you know what I'm saying? Then you have enough room. Instead of they going 5 feet, you go to 10 feet away from the line.
Yeah, so it is, the trenches as proposed do follow the contours. So yeah, I know what you're saying. Like if you line them up with the contours, you have
Right.
less grading. Yeah,
Right.
this is the best I could get it.
I got it. It had to be a reason why you did it that way.
Yeah.
Okay. But do you have enough room, you think, in the event something happened to this one? Don't they usually replace it, or they're gonna just put an extra one and leave the one there?
You know what?
I don't understand.
A lot of times when we have a failure, we end up digging up the existing system either to figure out what happened to it or
Right.
just to replace it. So I've never actually built a reserve area in the spot where a reserve
Right.
area has been proposed. It's just never
Because
happened.
I had a situation myself. I had to several different times. I mean, if something goes wrong with the septic system, because it doesn't function or something happened, is a crack or something like that, sometimes they can repair, sometimes they don't. They just wait, take it out and put a new one.
Yeah.
But it could be something, maybe something new like that. Must be. They're trying to figure it out. If something goes wrong, they can put another one. Eventually,
You just have to show that you have enough area to be able to put another compliant system in.
Yeah. Is it for 4-bedroom? Am I correct?
Correct.
Nobody else in the area? Anybody so close to the property? No.
There's a neighbor on the left-hand side of the screen. And they know of the project, they know of the current owner, and they're not going to be affected by the variance.
I got it.
And then this parcel over here is a vacant lot, and it's to remain vacant.
I got it.
I have a question for you.
Mhm.
It looks like the contour lines are, going into where the house is shown. Am I reading that correctly?
Yeah, they're drawn like that to show, like how, if I have them tie into the house and terminate, it's difficult for the installer to understand where the contours have to be.
Right.
Well, how are you just going to let them butt up to the house?
Yeah, absolutely. The top of concrete is going to be higher than the top of the mound. Yes.
Oh, okay.
Well, I don't have,
It looks like you're proposing town water instead of a well.
Correct.
Okay.
Yeah, there's town water is actually out at the street existing. There's a water main that runs like this, and then there's actually a hydrant at the intersection of Stowe and Colonial Drive.
Okay. Before we ask Jim his questions, is everybody all set? And before I ask Jim, any abutters in the audience at all?
There are no hands raised, Lisa.
Okay. So Jim Gorecki, can you give your comments on this?
Sure. So again, as Jonathan mentioned, it's a new lot. I think maybe some of the confusion Louise is mentioning is there is a darkened box for a house. And I was going to talk to them after that anyway. I don't know if that was another thought about a house location. That house box wouldn't fit the darkened lines there, Jonathan. So I assume it's the box that's underneath those. That's going to be the proposed house box.
Correct.
Okay.
Yeah.
So I think that may have cost, because that foundation would be on top of the septic tank too. And that just wasn't going to work. So
Oh, yeah.
we can probably get that cleaned up so we can issue a permit on something that shows, because the location and elevations will be critical on these small lots with this fill. As far as the fill to the lot line, again, I agree with Jonathan. I don't think it's going to affect anybody. The lot does grade towards those catch basins, so any kind of surface water should be able to grade off the site or drain off the site to the basin. So other than just kind of verifying the house box so that we know where it's going to go in the elevations, I don't really have an issue with the plan.
So, and those catch basins that you were talking about, Jim, those are on the other street and on Stowe?
Yeah, there's two right at Stowe. If you look at the lines kind of go down.
Yeah, the CB, yeah.
Yeah, and then they're right down there. So that low part of the lot, you know, if the water didn't get contained on the lot, there are catch basins right there. But there's a good sized spot on that parcel 122.
So, and you said you didn't have a problem with it?
Yeah.
Anybody else have any questions or comments?
I have no problem with that. 5 feet. That's all he
Okay.
wants.
Can I, does anybody want to make a motion?
I'll make a motion to allow the 5 feet from the line.
Is there a second?
I'll second it.
Well, I don't like it the way it's worded. I would like to add in there that they need to fix the plan to show the house
Mhm.
correctly.
So, Jim, if you get it with those markups, and that dark line removed, and it's what you think it is, and then we'll accept it, Louise, if she thinks it's okay after that dark line is removed.
Yes,
A clearer plan of where the house is going to be.
yes, yes.
So we can add that to the motion. And Mike, you'd still second it?
Yes, with the addition.
Okay.
And the specific reference to 122 Greenfield Drive. I'm
Thank
sorry. Ivy Road and Lake Drive. I'm sorry.
Thank you, Mike.
No, this is still Greenfield.
Yeah, this is green. Yeah.
I'm sorry. That's what I had here is Greenfield. Then I started thinking Lake. I'm sorry.
All right, so let's start from the beginning. I can't make the motion, right? But
So 122, make a motion to approve the plan for 122 Greenfield Drive with the house plan corrected
drawing.
as shown, no, corrected on the drawing.
I second.
okay. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan, yes. All right, thank you.
Thank you. Have a good night.
You'll get that drawing cleaned up and sent to Jim, and Jim, if it's cleaned up and it's just the way we said, then that's fine.
Okay.
Great.
All right, I'll get that over tomorrow.
Okay. And let's see. We're a little bit early for the Ivy Road and Lake Drive variance discussion, and I'm not sure if we can move ahead because everything else looks a little more complicated. I don't think we can get it done in a few minutes. So, does anybody do any member comments or anything? Janet, is it's okay if we do member comments now?
Of course.
And any comments from the board?
No.
Mike,
Yeah.
Sorry, I missed that. What was that?
we've got like 15, 10 minutes
Oh.
or so to kill before the next public hearing. So I was just wondering if anybody had any member comments. We can't really go into COVID or the cat discussion with this little amount of time. So did anybody have any member comments?
I don't have anything. Kevin, what did you do with your kids on Halloween?
We went to an undisclosed location and sort of just hid some candy around the yard and had a little treasure hunt. We did set up a pipe just in case we had any other trick-or-treaters to shoot the candy down the tube, but there was nobody came.
Yeah.
I guess,
Sad.
did you guys see the Boy Scout, the letter from Paul Cook regarding the Veterans Day flag ceremony?
Yes.
I'll read it. Hello, Janet. This is Paul Cook. I am the Scoutmaster for Troop 20 in Littleton. The Scout Troop in Littleton hold an annual flag retirement on Veterans Day. With the surge and the governor's recent changes, I want to make sure that the requirements for this event would be for an event like this. We are requiring masks and social distancing, just not sure of the group size yet or now. What, Louise,
Yeah, it's a really nice ceremony. It's a nice ceremony. They retire flags. Old
is it all
flags.
done outside?
It's done outside, but there are a lot of veterans. Not a lot, but several veterans show up. I don't know. Maybe there's and the troop is there, so maybe there's 30 people normally or 40 people. I don't know.
And but it's outside. And what do they do? Burn them or
They burn them. Yep,
Yeah.
they burn them.
Uh-huh.
It's a very solemn ceremony. It's kind of cool. You should go watch it sometime. It's
Yeah, I couldn't think of two populations that shouldn't be together.
Yeah.
In large numbers like that, even outdoors. It's sort of like almost a sure bet if any one of them are carriers. I believe even for outdoor gatherings, there's some guidance on the number of folks who can total number of individuals.
Yep.
So knowing the number, restricting the numbers ahead of time, or providing some guidance might help the troop leader scheduling.
Yeah, that's what he's asking for. Jim, what's the number for outdoor gatherings now?
So when we talk about the COVID updates, the governor changed the gathering
Yeah.
order. So I think they could have up to 50 people outdoors in a gathering. So I'm happy to contact the Scoutmaster to find out how they do it. Mike, to your point, we can certainly make sure they keep the kids on one side and the veterans on the other side, just so they can try to keep those populations apart. But I can certainly go over with them the concerns and the distancing and the numbers. I've read through the new gathering order once or twice, but it's a lot more nuanced now, and so I really want to look at what they're proposing to do and in light of that plan.
That would be great.
In view of our status.
Yep.
I'm just wondering, and I'm not trying to cut into this very important event, but I'm wondering if we should. If Jim, would it be worthwhile considering reducing the number of folks, but making sure as many veterans can show up and as many of the troop can show up to get the ritual finished in a respectful fashion without raising the threat level?
Sure.
50 just sounds like a lot for a town that's in the red.
Yep. No, I can certainly have that conversation with him that you'd like to try to minimize people on the ground.
I'm not sure if there are that many that show up, but I don't think there's 50. Have you ever been to a gym?
I have not. We normally do, when we do that, we normally do it on a camping trip. So.
Oh, you do?
Do you know him, Jim? Do you know Mr. Cook?
I know of him, and I might know him to see him, but.
Yeah.
But I can certainly have that conversation.
I know him.
Just seems like such a high-risk population that's going to be out there with another potentially high-risk spreading population. I don't know, but
There's younger veterans too, guys.
I know everyone's at risk. So
I mean, typically they have like the scouts line up and they bring a flag up to their like an area where the embers are burning, and they lay the flag down on top to burn, and then they walk around to the end of the line. And the veterans could get in that line also to bring a flag up, but maybe they just have the scouts do it and the veterans just stay away and watch this year, or I don't know. There's something a different way to do it.
Or, I hate to say it, is it something that can be postponed till next year to keep everybody safe?
It's the flags will keep
Yeah.
till another time. I mean,
Right.
it's all about disposing of flags honorably.
Right.
So if you put them in a box, you could certainly keep them until there's a safer time to do it.
Mhm. Yeah, so everybody can participate if that's what they want to do.
Yep.
So, all right, thanks, Jim. We still have 4 more minutes before the public hearing. Is Ian Rubin here, Janet?
Who's there?
Yes.
Yep, I've just moved him in.
Okay. Ian, we still have a few more minutes just to,
He could set up his plan if you want.
sure, yeah, if you want to do that.
I have a question. Is next week, are there gonna be properties, septic system plans to look at? Plans? Or will it just be like a COVID meeting?
Janet, do we have anything for the agenda?
Next week, we're not meeting. It's Friday, though, right? Oh, let me pull up a calendar, sorry.
I thought we were meeting every Wednesday in November.
Well, next Wednesday is
Day.
Veterans Day.
Veterans Day, so the town hall is closed.
Oh, right, sorry.
And then the following week, we have a 7 PM and we do have some septics on the agenda. And then the following week, which is the Wednesday before Thanksgiving, we're meeting at 3 o'clock and we already have some septics on that one as well.
Okay.
Will we be doing COVID updates those days too?
Unless you tell me otherwise.
Okay.
Yeah. I have it tentatively on the agenda because I assumed that that was what you wanted, but
Yep. And Jim, you still can't come next week?
Next week is the Veterans Day, so, but the 18th, the 18th I can't come because that's when Boxborough will be meeting. But the 25th I can.
Excuse
Lisa
me, Madam
Judy has a
Chair.
question.
All right, go ahead, Judy. Hi.
I guess I'm here as representative for Troop 20. I was just on their Patrol Leaders Council.
Oh,
And
how
somebody piped up
convenient.
and said you guys were talking about Veterans Day.
Yes.
So I bumped over, so I haven't heard what you guys were talking about. We were looking at what was the capacity for outdoor gatherings, whether it was 25 or 50, and keeping it just to the 2 troops, the Troop 19 and the Troop 20. They said they have like about 4 or 5 bags of flags that they plan on preparing on Tuesday at our regular meeting so that we have less stuff going on and less people not inviting the other troops or the packs. So
Judy, Jim was saying that outdoor groups can be up to 50, but where we're in the red, we didn't think that that was a really good idea, especially if we have older veterans also in attendance. That might be kind of dangerous for them. So did you guys have, Jim was going to talk to Mr.
Cook. Okay.
Yeah, and see what kind of attendance you guys thought you might be having. Do you have any idea how many scouts and how many people usually come to one of these?
Usually when we promote it, there's Louise has been there, I think, a few times. Usually when we promote it, it could be 50, 60 with little kids and veterans. But if we don't promote it, there's
Just your
20
troop.
at most.
Uh-huh.
Because if it's cold, especially if it's cold out, nobody wants to be there.
Mm-hmm. All right. Jim, will you still talk to Judy?
Absolutely. Yep.
Judy, we've just had Ian Rubin come on for the 7:30, so.
Thank you very much for taking a little bit of time. Appreciate it.
Yeah, no problem. It sounds great. I have to work that day, so I won't be there, but it sounds like a nice thing to do.
Okay.
Thanks.
Thank you.
All right, so it's 7:30, so we're going to move on to the public hearing at Ivy Road and Lake Drive with Ian Rubin for a variance request.
Good evening, members of the board. Unfortunately, I have not had a chance to notify the abutters on time. So I'm going to have to postpone this hearing.
Okay.
I'm not sure, obviously, next week you say you're not having a meeting. So we'll have to do it for 2 weeks from today.
Janet, can we get them on the schedule again?
You can continue it to 7:45 on the 18th.
On the 18th. Okay, Janet, I do appreciate it, and I apologize for not notifying you sooner, but unfortunately, I found out that the mail wouldn't make it on time, so.
Okay, so we're going to continue the public hearing for Ivy Road and Lake Drive variance request for our meeting on November 18th at 7:45.
Okay, thank you very much.
Lisa, if you guys could just make a motion for that, please.
Somebody needs to make a motion.
I make a motion to continue to 18 of November, 7:45 p.m.
And Janet, do I need to make a
Need the
roll call?
address. Let's put the address in there, Gino, please.
Okay, give me the address.
On the agenda, Gino. Ivy Road, Lake Drive.
Okay, thank you.
So you have to repeat it, Gino, as a
No.
motion.
You know what? Okay. I was looking on the phone and I didn't find the agenda. So you got to tell the young lady, Janet, make sure that every time we have a meeting, they send an
No,
email.
it's right here.
She sends it to you, Gino. She sends it to you.
It's on the
Yeah,
website.
2
It
weeks ago.
actually was sent twice. I sent it last week and I sent it again last night. If we could get.
I'll make a motion to continue the hearing
Kevin?
to the next meeting, corner of Ivy and Lake, November, is it 18 at 7:45?
Ivy Road and Lake Drive.
Road and Lake Drive.
Thank you.
Thank you.
I'll second it.
Thank you, Mike. And roll call, Kevin Baker,
Kevin Baker, yes.
Gino,
Yes.
Louise,
Louise Nichols, yes.
Mike,
Mike Selden, yes.
Lisa Flanagan, yes. All right, now back down to administrative matters. Jim, you're still with us, so any COVID-19 updates you want to?
As I mentioned, the governor on Friday had 3 orders, one affecting face coverings, one affecting gatherings, and one affecting the closure of businesses primarily that sell alcohol. So the face covering one, I think, again, I haven't had a chance to go through them completely, but I think the operative pieces in there are they remove the whenever you can't maintain 6 feet from it. So it sounds like they want everybody wearing masks most of the time. The other part that's in there, and we're waiting for some guidance from Department of Public Health. The other piece that they put in there, they talk about public locations, and they give examples of what public locations are, which include things like public ways. Again, we're waiting for a little bit more guidance, but it's just tightening up when they want those masks worn. They also mentioned in that it doesn't really change. You know, if your business is covered by a workplace safety standard, you need to be wearing masks in accordance with those standards also. I think what they're trying to do is just get people to wear masks more often. But again, I want to go through the document again and see what Department of Public Health has for guidance.
Yeah, I was just looking at that quickly at lunchtime, and something that I want to talk about a little bit later is requiring during a carpool with non-household members.
Yep.
And is this new too about using the medical grade, because they're again reserving it for healthcare workers and first responders?
I think because they're asking him probably be worn more often, yes.
Okay.
But that's been out there since the very beginning. That's
Yeah.
some of the
I know that,
controversy
but-
we got into it early on with about whether you should wear them or not is.
Right, yeah. Yeah.
And they're still allowing people that have a medical condition, not that they don't have to wear it if they.
Well, they tightened that up a little bit because now you can ask for proof of that.
Oh,
Employers, yeah, so
really?
that got tightened up a little bit in there too. They're you know, I think probably in response to people just saying, oh, I got a medical condition, now maybe businesses and whatnot can ask for that rationale. And it does
I
state
didn't
in the
understand
executive order that if you refuse to wear one, that they can deny you entry to the business. So.
Mhm. And it says there's going to be a violation, a fee, a charge per violation too, so.
Yeah, that's been in place, so
That happened,
I'm
okay.
concerned about how it will be enforced. We know now the way places call, so are we going to get calls every time somebody's walking down the street without their mask?
Yeah, yeah,
Probably, and I don't know how that's enforceable, so.
Yeah.
That may
Okay.
be a challenge. The gathering order, again, I think what they're trying to do is clamp down on the the private parties. So if you look at that, they're limiting even the size of private parties and the number of non-household members that can be in a private party. Again, I don't know how we're going to enforce this. I suppose it may be that if somebody, if there's a raucous party at a house and the police get called, they can use this to enforce. But again, they're tightening up. Again, they're recognizing where some of the spread is happening, and they're trying to, I think, partially make people aware of the fact that these are the places we're seeing spread, and trying to provide some teeth for towns, for boards, for police departments to enforce. So again, I'll go through it. My goal is to go through it and try to put a kind of a bulleted list of what it means together, so that people can, it's a little easier than trying to read through it all. And then the last one's talking about places of business that sell alcohol and adult cannabis. And again, what they're looking to do is try to get people home by 10, by closing the businesses down by 9:30. So.
and that's mostly to keep the kids home,
Well, the older kids who can go buy alcohol
right?
and maybe are hanging out at restaurants that serve alcohol a little bit longer, because we still aren't allowed to have bars at this point.
Right.
And that's becoming some of the challenge we're hearing, that, you order some food and then you linger and just have more drinks. And my thought is, once you're done with your meal, if you're ordering drinks after that, it's really a bar. So again,
Right.
there's a advisory out from the Alcoholic Beverage Control Commission. So that may get sent to all the restaurant businesses, just to make sure they're aware of what's allowed and what's not.
Mhm.
I have a question for Jim, Madam Chairman.
Sure.
Sure, Mike, go ahead.
Jim, I was wondering, we don't really have much solid information about, I know this sounds silly, but we don't seem to have much information, at least the way we've been operating in Massachusetts, about frequency of, shall we say, non-masked people who are not properly masked or not masked at all. In other words, we're reactive. We get a call from someone and they say, in a grocery store, somebody's not wearing a mask, and that's it. And you're supposed to do something about it. I'm not sure that's an effective use of limited resources, namely having you chug around town looking like that. So sort of a two-part but question. First of all, would it be worthwhile if you had the help, whether it's one or two more people who could take very simple instruction from you, not to intervene, but basically do what I would call maybe three instances of survey at different times of the day in what we'll call typical gathering places during the day. This were places where people stop to get gasoline and coffee, shopping in town, just to get an idea, just data collection of, are people using the masks?
So
we're not interested here in going up to people and saying, put your mask on properly. If you want to do that, it's fine. It's more of, what are we dealing with? Because the mask, including social distancing, I'm not trying to put down hygiene, but the mask seems to work pretty well for communities or groups that actually practice masking, shall we say, in a very disciplined fashion, like the kids in school and the staff I'm very impressed with the performance of the schools. And also the fact that there's data now out in certain planned situations where the mask has proven very effective. So, but I don't know, in your opinion, would it be valuable for the Board of Health to have some idea of, during this period of time, between now, let's say, and I'll just make it up, Thanksgiving, because I think we're going to be here for a while, to get some idea of just how often, how much this town, or how frequently in town, shall I say, masking is being used.
So let me kind of answer in a kind of a meandering way. Hopefully I hit all your points, but so for the places that I've gone into, like the supermarkets and the retail stores, I usually go in when I'm responding to a complaint. I go in and walk the store first. And so from that perspective, I just happen to show up. I don't call or anything like that. Mask wearing in those situations, as I've mentioned to you before, is pretty high. I mean, and the incidents are minimal. Where I don't always get a chance to go into a place like restaurants and stuff like that. So it would be nice to know what those places are like. Now, obviously, people sitting at tables are going to have their masks off. And I can't be in the town all the time, but obviously those times, those locations, it would be great if you knew at supper time what it looked like. Because that's probably the biggest time, or lunchtime, depending on the facility. So that information might be useful. To your point about the effectiveness of mask wearing, I just got done doing close contact follow-up with, there was a teacher who went in a classroom not in Littleton who had tested positive, and there were 26 affected people. Fortunately, none of them came down with the disease. All of them were wearing masks. So I would agree, the masks seem to be an effective way to try to protect people in situations like that. So.
Yeah.
So I guess the short answer to your question, it'd be great to know what's happening in town when nobody's watching. But I think in most places, particularly like the retail stores, I think they've taken the brunt of complaints. And I think for the most part, they do a pretty good job, at least in my estimation, from the inspections I've done wearing masks.
Yeah, you're going in to inspect and respond.
Yep.
To express concern, and I was coming at it from a softer point of view. So I was just wondering if there were, shall we say, another set of eyes that were only assigned to report back what they saw, not to intervene. And I'm talking about going into, I'll use places where public services like gasoline and food are done together, including the few restaurants that have to be looked at. I mean, it's probably maybe 40 places altogether, maybe, including garages, which are very interesting spots. The coffee, food, and automobiles apparently be a great place. What I'm thinking of strictly is trying to get an understanding of the fact that we are slowly going up along with other communities around us. And it appears that the main place of transmission is in family gatherings or in gatherings where you have social events going on, but it starts somewhere. So what I'm interested in is if we get some idea that masking, not, shall we say, as disciplined in general in town, it'll direct us to what additional measures which we should take. But we can't do it because we're flying blind. We can't depend on reaction. I'm talking about what's going on in the zoo, as it were, when nobody's watching, as it were. So if you had another pair of eyes, would that help you at all?
Yes, because what it would do is somebody could go in and say, hey, I was here at supper time and this is what I saw.
That's
I'd
it.
be more than happy than take that information and go talk to those businesses and say, hey, look at the workplace safety standards require you to do X. These are the reports we're getting. You're not doing it. You need to kind of make sure your patrons, your staff are doing those things. So I would find that helpful. And to your point about food, cars, repairs, I do have a follow-up to do at just one of those businesses. So.
Jim, are there a lot of repeat offenders in anywhere in particular?
So most of the complaints I got, and Janet sent me one today, the short answer is yes. And I will go and check with the store in question in today's email. I've been there a couple of times to have conversations. I find that disturbing if that's the case, and I want to have a conversation with them on that. But again, in most cases, the market baskets get hit hard. I mean, I've been to market basket probably 5 times. And again, if I find one person who's got it down under their nose, that's about the worst I've seen when I've been in that store. And I've been there in the morning, I've been there in the afternoon. I shop there occasionally, even after hours. So again, I haven't really seen what I would consider a substantial violation of the mask wearing in that store. And when I've popped into Donnellan's, we had a complaint, but I popped in there for the most part, same thing. Abishan's, we've gotten, I think we got one complaint, but when we went in, Louise and I went in there to talk to them about masks. Again, compliance is decent.
Mike, are you volunteering to be that person?
Oh yeah, that's really what I spend. Good use of my time and pay grade. Yep, absolutely.
Last night at the election, there were a lot of people wearing their masks below their nose.
Polling place, yeah.
No,
They have covering just their mouth.
Yeah, I'm hitting more on finding out what's going on, not so much for the enforcement part. Chasing after people is not. I'm trying to basically try to understand how the virus ends up in so many, shall we say, households, where it appears that most of the infections they're connected with them. Unless, Jim, you feel that's way off.
Well, I mean, again, as we're seeing it, people look at numbers and they say, how come the numbers are so high? And then you start looking at the reports, and it's not uncommon to see if there's one person in the house who gets it, that other people in the house who get it. And we've had families where it's gone through the entire house. So where it's coming into the house, I don't know. The only kind of casual observation, I think Tamara and I were speaking today, it seems to be parents to kids, just in the little bit of castration she's done. So, kids, to your point, Mike, are probably sitting in school and got their mask on, and parents are out in the working world potentially, and a number of different encounters. So I think it's a probabilities game. There's more of it out there, and we're moving more, and we're encountering each other more. I know that's not a very good explanation, but lack of a specific one, I think that's part of what's happening.
So it's not that schools need to be closed to keep parents working. It's work needs to be closed to keep the schools open.
Well, you can get into that. Yeah. But yeah, I would, and again, it can always start, and the state's enforcement model is to do education first, do written education second, and then if somebody's just being that recalcitrant about it, you could start to fine if you wanted to.
Anybody else have any more questions for Jim, or do you have anything else to add about the COVID update, Jim, besides the three changes from the governor?
Those are the big ones. And again, I've a handful of complaints to follow up on. I will do it this week.
Did you do that snapshot this morning, Jim? Did you have a chance?
Beg your pardon?
Did you do that snapshot this morning?
I did not. I got the numbers to Mike, and then I was out in the field the rest of the day.
Okay.
Yeah.
Do you have numbers yet this week, or an idea?
Yes. Jim provided the snapshot, and our ace epidemiologist from CAT will give us a beautiful, as usual, update.
Okay.
Great transition. Great transition.
That's a nice little segue, Mike. Very nice.
I believe in loquacious extended introductions.
All right. Katrina, are you ready to start? There she is.
I'm trying to get my slides up for you guys. 1 second. Every time you guys flip me into the meeting, I lose my setup. Give me a second. Jim, thank you for sending the numbers to Mike this morning.
Nope, not a problem.
And I don't know if it's useful. If it is useful for me to run the rates for the other catchment towns that you have, let me know. easy enough to do.
Yeah, today just ran out of time.
All right. Can I see what I'm doing? So let's see if I can get this going. All right. Do you see my slides?
Yes.
Great. Thank you. All right. So we're back another week. This will be a mixture of things that are current from the state level and things that Jim has given us. And the rates that when I start calculating them will be from the last weekly report, which was on Thursday, last Thursday. So the state kind of changed everything this week on their daily report. They are presenting things very differently than what they were last week. So this, I just wanted to give everyone a snapshot of what the state looks like. And this graph looks at COVID-19 confirmed cases since March. And so you get to see the curve. And in the last week, there's been, I mean, you can see it. This is 2 weeks ago. This is last week. The last week, it's been over 1,200 cases a day once they put them on the right date. And that, you know, we're going up. We're similar to where we were at the beginning of April, numbers wise. So we're on the uphill climb again. We're on the second wave. And so the state also is now calculating their average daily incidence rate for the last 2 weeks every day, and it's now 15. It was 11 last week. So things are going upwards on the state side. And then this is the map from last Thursday when they do the town report, the by town report. And as you can see, things are just heating up. It's becoming red. COVID's more widespread right across the state. Even in some of these gray areas, there are cases. So it's pretty much everywhere. I'm going to quickly go through just kind of skim by the methods of what towns and how we do the rates. They're available in the packets if you guys need it. But just want to land on the rates themselves. So here are the average daily case rates that we calculate and based on last Thursday's report. And Littleton's rate last week, we had 12 cases and the rate was 8.8 per 100,000 population. So that was trending higher and we were back in the red. So we were in the red, I think it was as of the October 14th report, we dipped back down in the yellow. We were back up last week and higher than we had been. So everything else is also trending higher, except for the border communities, which was a little bit lower, but they're essentially on the same. These are the averages when we look at all the towns together. So while they're in the yellow, they are also trending higher for the most part. So this is the graph of all of those areas that we follow, just so we can get an idea of the trend line, and everything, as you can see, is going higher. Our border communities are the red ones and our surrounding communities are the green ones, and they're all lower than we are as a town. We're back up in the red right here. We look more like 495, which is this purple line, and then the county and the states, you know, trending upwards as well. So everything's going up. We seem to be going up a little higher than our surrounding community. And this is the updated graph from the one I presented last week with all of the towns that fall under the surrounding community graph. Just wanted to get a feel and just to make sure that it wasn't just a 1 week, oops, we are dipping back down. We are still among, you know, the highest towns in our area for our rate. So the bright blue line is Littleton. The black line is the aggregated or the average rate for all of these towns when we put them together. And Littleton is consistently above the average and in one of the higher towns. So we're trending differently from our neighbors, including those in the 495 belt that we calculate.
Could you go back one slide? Who was the curve, the really high one? What town was that?
That was, I can't go back. That was Chelmsford.
Okay.
That was Chelmsford, and they have a notable cluster in a long care, like a long-term healthcare center. So
okay.
And then Bolton, I think, just caught up to us with, they are so small. They also have the jumping issue that we have.
Okay. Thank you.
You're welcome. Sorry, I should have slowed down. So this is a 2-week graph, which is not a trend. It's just 2 points. But this is the snapshots that Jim's given us. And I started thinking that it might be useful, since it is a different data cut, to actually graph it and see what's happening. So when Jim does he pulls the numbers of cases out of Maven, he's trying to target pulling them out as close to the time that the state will extract them for their data analysis as possible. But it could, Maven's cases, if I understand correctly, they come in and out all the time, depending on if they're resolved or not. I'm not entirely sure how that works, but so this is Jim's sneak peek in. And so this is last week, where Jim gave us a number of 11 cases, and which resulted in a rate of 8.1 for the Wednesday snapshot. And then today he gave us an estimate of 19 cases, which results in a rate of 14. So we had a large jump, and we also had a large jump in the number of cases. So, there's an additional 8 that were, the numbers were different. Some fell off from a couple of weeks ago, and we still had 8 more. So we are trending upward. So while I just want to note that tomorrow the numbers might look a little different than this, and it's no fault of Jim's, that's the way it is. It's the way the data is. And when he looks in. So I will expect that tomorrow Littleton will remain in the red, that we won't lose 10 people off of this. That would be weird, but we'll see. But right now we look like we will remain in the red tomorrow. So the next thing that we've been tracking is the test positivity, the total test positivity. This is last week's numbers again, the ones released on Thursday. Everything is trending higher, except Middlesex County we allow for some variance of 0.2%, because it could go up and down and still be pretty level. But everything has been essentially trending in test positivity over all the areas we look, the state, 495, surrounding communities, the border communities, but in particular, Littleton had a jump last week. So we had a test positivity of 2.34%. And when you graph that and look at the trends, everything is, again, trending upwards slightly. We're not slightly, we're trending upwards. This is going to take a lot of cases to move quickly. And unfortunately, I think we're starting to see that a lot of these lines are bending up quicker. But in particular, Littleton had, in comparison to the October 22nd report, last week's report was 2 times higher than it was. So the 2.34% is the highest of all the areas that we've been tracking. So this isn't a good thing. So just the big summary is that everything's red. Like the main areas that we're tracking, the state is red, the county is red, Littleton is red. The areas around us are doing a little bit better, but Littleton's trending higher than the areas around us. And this is last Thursday's numbers. So that was 12 cases as of last Thursday's numbers. And I just told you that we had Jim's snapshot is about 19 cases, which is even higher than that. So things aren't looking great. The things that I've been listening to the governor's presentation, the revised weekly DPH report includes some information on contact tracing, what they're finding there. It's pretty rough still, so it's hard to parse, but between what the governor has been presenting and the data in the weekly report, we get an idea, and what Jim has been sharing with us, that the household transmission is a big driver of everyone's rates in the state. So like Jim pointed out, if one person is exposed and is sick, then the other family members quickly end up testing positive or becoming a case too. So if there's any way we can think about that might be a good place for education and teaching people like what to do if one family member gets sick, if there are ways to isolate among family members and to improve, especially for people with high risk family members, things like that. There's social gatherings and social clubs. There's like a number of clusters, and like there was a cluster in an Elks Club and I don't know, all those kind of like gathering spots basically are showing, it's one of those bigger contact tracing things, sleepovers. So I think as Jim was talking about the new stay at home advisory that the governor put out, I think part of the reason that they're trying to target that 10 p.m. to 5 a.m. timeframe is the social gathering time, like people staying out late, probably drinking and less likely to be wearing a mask during that, but also sleepovers. There's been a number of people who are still gathering or still socializing that way. You know, little kid birthday parties, this isn't the year for the sleepover. The carpooling, unmasked carpooling is definitely a time where you're sharing air with people pretty close quarters. So that would be another place to maybe put some education behind. And then there's a number of clusters that the state identified specifically with hockey, but also with basketball, those higher risk contact sports. So the other thing that was notable to me, this is from the daily state report, the one they put out every day, is the difference. So this is again from March all the way to October. You can see these are by age band. So this is the light blue on the bottom is the youngest age group, and the red on the top is the oldest 80 plus group. And you can see in the spring, we were definitely seeing most cases were among the older age brackets, but now we're seeing them in like 0 to 39 is the bulk of the cases that we're seeing. So that's families. That's, you know, as Jim just said, like an adult might bring it in, but then everyone in the household gets COVID. So this actually supports the contact tracing things that we've been talking about, especially with like late night social gatherings in the mid-20s and those things. So again, that ages who we need to target are different now than they were in the spring.
That's a really interesting graphic.
Yeah, it's I figured out how to turn it back. Okay.
Yeah.
Yeah, it's definitely
Really shows it.
And the other thing in other states, this other epidemiologist did like a heat map like this, where it started with the younger people, and then the bands actually spread to the higher people, the older age groups. So this is concerning as well, because everyone's mixing, and it's really hard to isolate just one age group because everyone needs support, and the higher the community prevalence, you know, not enough masking, things like that. Everyone's at risk, not just certain groups at risk. It's so yeah, we're looking at a different age groups to target right now to see if we can keep our rates flatter. And I think they're going to keep going up, but can we slow that growth at all?
Katrina, do you have any insight on why it was so low for the 0 to 19 years?
Yeah.
Those first few months.
I do. Two things happened. We closed schools, and when we close schools, we keep parents home. So part of it, and colleges and everything closed too. So everything really shut down, and people were sheltering much more. In addition, there was a testing issue. We didn't have tests, so they were saving them for people who were symptomatic, and the symptomatic people were tended to be in the older age brackets. So part of this is access to testing that you're seeing. Who we were testing in the spring, because there were limited testing resources, were very different than what we are able to do now that there are more testing resources. So that's part of it.
And same for the 80 plus years up at the top, they were probably being tested more.
They were more likely to be symptomatic. And this is where in Massachusetts, most of our cases were in long-term healthcare centers, like, you know, the Life Care Center. They would fall into this group. So part of it is just where the outbreaks were really taking off and where the tests were being sent to be used. So,
thank you.
Welcome. Okay, so Jim touched on this, and I'm I'm very thankful he has more details than what I could get my hands on. So this governor announced the stay-at-home advisory, which begins this Friday. And the website that I've found the most information is right here. It's the mass.gov news stay-at-home advisory. It's pretty easy to find. So the idea, again, is it's not because it's less, the COVID is suddenly more infectious after 10 p.m. That's not true. What they're trying to do is change people's behaviors and keep people at home and with members of their own household and not mixing with others. So hopefully a large number of people will heed the advisory and stay home when they're supposed to. The governor kept saying to make sure that you're home with members of your own household. So over and over, he has repeated that what he expects is that people won't be going over to stay at someone else's house outside of their household, because any shared air is where transmission happens. So we're trying to minimize that. There were exceptions, like if you need to go to work or you have to go to a pharmacy or grocery store, you can go to pick up food, like takeout, things like that. They're still letting you do that during those timeframes. They just don't want you hanging out in a restaurant, just having drinks with friends at that point. And then if you do leave home, they keep practicing your good social distancing. I know in the UK, when they applied some curfews, people would leave the bars at the same time and then just go into houses together. And that is what we're trying to avoid. So hopefully people will think twice about that. Also, they specify not having gatherings in your home with anybody outside of your household. The governor kept talking about watching football together, unmasked, hanging out. Sleepovers came up. Like there's a lot of things like that, that when you share air, especially in time that you're unmasked, you're at higher risk of transmitting COVID to others or getting it yourself. And then he did, the gathering limits were updated. I heard a maximum of 10 indoors and 25 outdoors. That may differ from businesses. I don't know how. I think the businesses have their own guidelines. These are for individuals who might be having people over to visit. So if you're going to be inside, you should have 10 or fewer people. Ideally, no one's inside your home and you gather outside, but still the more people, the more risk there is of transmission. And then there is an updated face covering guidance, which, so I know that the messaging around masking was just botched this spring. It didn't go well from the start because they were trying to save masks, like PPE for healthcare workers. And as a result, it just got all confounded. It's just it didn't come off well. So, but what we do know over time, and Mike was alluding to this earlier, that masks do help slow the transmission of COVID. Even masks like, cloth face coverings, this helps keep droplets from spreading into the air, and they do filter both ways, whether it's enough. They're not perfect. There's definitely going to still be some that get out, but if you reduce the number of droplets and aerosols in the air that everyone's breathing, then we're less likely to have an effective dose to get sick. So the governor and the DPH simplified the mask message. So at this point, their goal was to keep it simple. We had a lot of if you're this, you don't have to wear a mask, and it got confusing. And I think that's partly why Jim's going to a million places to deal with the mask compliance. So the governor was very clear that the expectation is that everyone who is 5 years or older will wear a mask or a cloth face covering over their mouth and nose when in a public location. And that includes indoor locations and outdoor locations. So if you're taking a walk, you need a mask with you. And then while they're not requiring masks or face coverings for kids ages 2 to 5, they are encouraging them. And I've seen many kids able to wear them. So I would encourage parents to protect their children if their kid can handle it. And there are exemptions, but they were very specific in the mask order that you need to get a medical paperwork to have it with you if you really do have a medical condition that would prevent you from wearing a mask. So, and they were also, the public places are without limitation and indoor and outdoors. So grocery stores, pharmacy, retail stores, those are places we've been wearing them. Places that host indoor and outdoor events, you're supposed to be wearing them. I know that, I'm not sure, I hope Jim has more guidance for places that are like holding weddings and things like that might help them. It was also very specific where you wear them on public transportation or in taxis and liveries and ride sharing, carpooling. Those were very specifically drawn out. And then also in public streets and ways. And I know this one's, if you're walking your dog and you're the only one in the street in Littleton, you should still have your mask with you, because if you pass someone else, you should be wearing your mask in public. So the goal is that everyone will just get in the habit of wearing it. So the more you wear it, the more you're used to it. And there is more information on the website. This is actually the mask order, the COVID-19 order 55. And that goes into effect Friday as well. And then always going to end on Swiss cheese. I was trying to make it a little more friendly and more detail around it. So let's layer up Littleton. Let's stop the spread of COVID-19. So anytime you're near people you don't live with, you should be wearing a mask when you're not eating or drinking. Wash your hands, stay at least 6 feet apart, meet people outside, or if you do bring people inside your house, improve ventilation by opening windows and doors, and take any extra precautions you need to around someone who's at higher risk for severe illness. That's older adults and anyone with a comorbidity that might put them at risk for needing extensive health care. And we can do these things if we just start practicing them. Our goal is to flatten our curve. Like, let's not keep going on this steep trend that we're going in Littleton. Let's see what we can do to slow it down. And then I had a question of, what do we do about Thanksgiving? And the state actually released a really detailed website with information. I have listed it, at the bottom here. You can just Google DPH and Thanksgiving, and you'll get a detailed thing. But the things that will protect us, the safest thing to do is to just have Thanksgiving with members in your own household. And next safest thing would to do a virtual dinner with extended family instead of being in the same place. And I know that's really hard to think about. If you do choose to gather with others, you're taking a risk. So you have to keep in mind that there's still the gathering limits that the state just enacted. So 10 inside and 25 outside. And anyone with a higher risk of severe disease should maybe think twice about gathering with others. It's really hard to say, but you got to protect those people who might have real severe outcomes. And then if you do gather, you need to make sure that, outdoors better, improve your ventilation inside by opening windows. Don't visit for as long, like don't hang out and cook all day, maybe just have a quick meal together. So keep your visits short, wash your hands when you're eating and cooking, wear a mask when you're not eating and drinking, and wear a mask when you're preparing food so those fomites don't land on the food that everyone's going to eat. The state also talked about quarantining for 14 days before and 14 days after your holiday gathering, so that 14 days before would protect the people that you're gathering with, 14 days after protect the community as you come out of it. Or you can go get tested to 72 hours before and after the celebration. And you should always follow, and if you're traveling, follow any local quarantine guidances that the state or the locale that you're going to have. And I think it's really important for people to know when not to go and join people for the holidays. So if someone is diagnosed with COVID, if someone has any symptoms of COVID, or if someone is a known exposure to COVID, they really should not attend any in-person celebrations this year. Join them virtually. And then if you come from a town with higher levels of COVID and you're going to another place, or if the people who are visiting you come from a place with higher rates of COVID, you really might want to think twice about visiting. Littleton falls into that higher rate right now. So hopefully people make good choices. That's where we are on that one. Any questions?
I'd love to use this slide on LCTV, the Thanksgiving.
I was kind of thinking you might, so I was trying to make it pretty.
Did you make that, or is that from the state?
I took the state has very dry wording. I was trying to make it more bulleted and just easy to digest. So probably could use some work still, but yeah, you can take these and put them on LCT.
Yeah, because obviously that's the next question, the next holiday, and it gives some really good information for people.
Yeah.
So.
Ideally, and the governor was very clear about this, the gathering limits being reduced and where we are as a state. If we value things like in-person school and being able to go to our jobs, then everyone kind of needs to clamp down and make different choices this year. It's really important. And we're coming into that holiday season where this is hard. And also it's important.
Yeah. All right. Did anybody have any questions on the board?
Nice job.
Thank you, Gina.
Yeah, very nice, Katrina. Thank you for all your hard work. We appreciate it.
The other members of the CAT team have been very busy too. It's not just me. I know I just talked to you guys most.
Sorry. Questions, Mike?
You're muted, Mike.
Yeah, I was trying to keep muted. I have a.
It's not like you.
Well, it's. Okay, just out of curiosity, Katrina, just to annoy you further, have you seen anything of the hospitalization rates and any mortality rates yet?
So the hospitalization rates are starting to climb. They're a lagging indicator. We're 6 weeks from when the rates started to climb. So yeah, they're starting to show that their hospitals are going to be under pressure.
Right. Now, one good thing is that the standards of care are greatly improved. Now, although this sounds very odd, it could work against us because this would encourage people to believe that, oh, if I get sick, I can weather the storm even easier than, let's say, back in the spring. So one of my concerns is that, and I don't have an answer for this, but the opening of the state sufficiently to try to revive the economy, which is important, have kids go back to school so that people can go back to work, is exactly what you don't want to do with this virus. I mean, it's contradictory. So the measures that have been suggested by the governor are, in my view, basically are not going to stop the, shall we say, whether it's Littleton or wherever else, these rates are going to continue up because in these kinds of confrontations with people moving around and not really sort of getting more numb about masking and all the rest, I have a feeling that we're heading on an upward swing. So I'm trying to see if there's anything that we could immediately recommend or do that would, shall we say, help suppress the pain and suffering that could go along with this, because it's very difficult in a town like Littleton, where although the numbers look grim, the, shall we say, the distribution of suffering is not surfaced. We're not seeing on a daily basis. What is it now? We're up to 18, 19,
19.
Katrina?
19.
Yeah, it's almost like lost in the wind.
Yeah.
So the question is that, is there anything that we could do that could basically give us a little bit more, shall we say, warning, as it were, so that if we get to people, shall we say, when they first become infected, can we pick up the asymptomatic folks, whether they're at Market Basket, the restaurants, whatever? Can we pick them up a little faster? If nothing else, to, as it were, just try to keep the number of folks circulating who are carriers from infecting infecting others. So the only thing I can think of at the moment is our old friend testing, which of course carries its own weight. So that's where I am at the moment.
The state Stop the Spread testing. So if people would like to be tested, there is free testing from the state. You have to go to, I think Marlboro is our closest site.
Oh, wonderful, Marlboro.
On the DPH website, I know. So they cited them in those really initially high risk areas. So trying to make it accessible to people in the towns which took off first. But so that is possible. If someone needs testing and can't get one from their PCP or whatever, then that would be, those are accessible. Those are available to us for free. But yeah, testing would be helpful. Surveillance testing. I don't know if there's a way to, I wish I knew more about the contact tracing and what happens, the process. I'm not aware of all this yet. But if there's a way for people to embrace notifying people they know if they've been exposed, or if they know they're positive, to notify your friends who you've been in contact with ahead of time, even if it's casually, to say, hey, I'm a positive case right now, and I was with you 3 days ago or 2 days ago. I think Jim uses a 2-day window from the Neshoba board.
I think we had a case in town where the person that tested positive was instrumental in getting his diagnosis out to the public, so people were warned and notified before it went through the process of public health nurses and things like that. So yeah,
that is one way to get it quicker.
Faster, better. Yeah.
Yeah, that is, if people could embrace doing that, that would be awesome.
Yeah.
So I'd like to go sort of like neighborhood in Littleton, as it were, and just say from 3 to 5 p.m. come and get tested. Make it as voluntary as possible. Free, obviously.
I'm sure Kevin wants to talk about his exposure notification too.
So the exposure notification.
Wait. Do I get credit for getting the stage set for you?
Yes. You set us up very well.
I'm after creds tonight.
Another great transition.
I'm on tomorrow morning.
The master of ceremony.
I need all the help I have to get. Yeah.
It's all good. You play a great straight man. So the contact tracing stuff, not only would contact tracing help, but if people do choose to go outside the state, is to notice your phone. When you're actually driving through the state of New York, this weekend or next week is actually turning on their Google Apple Exposure Notification Express. So one of the things you're doing, if you go to New York and you happen to be part of that cluster of going to New York for Thanksgiving, please turn that on your phone, because that'll help you as you travel away and come back to the state. So those are good things, is to keep your ear to the ground as far as that goes. The state, as you enter, your phone will also get notifications automatically that there is a service that's available. So you definitely want to be paying attention to that as you travel through those states if you do. As far as contact tracing goes, until we can get the state of Massachusetts to turn on this technology as a tool to help Jim out, the only thing that we've got is exactly what that fellow Little Tonian did, which is start to call all of his friends and family that he had for the other moments and try to make that kind of happen.
Nothing to be ashamed about.
There's nothing, you could be doing everything right and
Yep.
you can get COVID. Like this thing is insidious. This thing just takes off like nothing. I do have to say, and that every time our calendar, Google Calendar, has become a where has our family been? There's like a color coded, basically if our family's been anywhere, everyone's exposed. But so-and-so was at soccer practice. So-and-so we hung out with X friend. Like those names are listed so that if Jim calls my number, I can tell him where our family has been for the last 2 days. But it looks like this for months now. I've never been taking notes this well.
The other thing that you can do also from a technology perspective, I'm sure most of us have Google Maps loaded on our smartphones. You actually can go and Google records all of your locations for you automatically. They do that as a free service. And so you can actually go in and see, I showed our CAT team today how you can go manage your location history. And so my location history, shows, the month of October where my daughter had all of her high school soccer games. That's where I was. You could see each of the different schools that we went to and me going over to Parker to drop her off and pick her up from practice. So it's really, there's a tool there that you can help remind yourself if you do, unfortunately, get the call from Jim that you could go there and say, oh, I was here, to help kind of jog your memory a little bit.
How nice of Google to do that free of charge, keep track of us. Isn't that wonderful?
It's an amazing thing.
It said free service. Yeah. That's,
right.
Yeah, exactly.
The contact tracing too, I talked to Jim a few weeks ago, and he was talking about how the teachers and the school nurses know where the kids are sitting and who they're hanging out with, but that there's also the memory of, the kids, have to remember that they jumped on the trampoline with Johnny, for 15 minutes to half an hour. Mom and dad might not know that because go outside and play. So there's the kids' memory issue too that they have to track too. So
if they're like my youngest, they don't remember what happened 2 minutes ago. So.
Yeah. Where are my shoes? Oh yeah, we shared a bottle of water. Soccer. Yeah, that's great.
So a little bit on the contact tracing. One of the things people are encouraged to do when they do the case investigating, so you do the case investigating on the person who's tested positive, is to encourage that person to let their contacts know and let them know that somebody's going to be calling them. It makes it a little bit easier for somebody to pick up a call if they know a call's coming. And the school nurses have been phenomenal about that, giving us that information the inside of the classroom. In some cases, actually sending the information home to parents so parents know that they'll get a call. So that kind of stuff works really well.
Jim, what number does he come from?
I always try to make our calls from our office here at Neshoba. So I think it says Neshoba board or something like that.
Because when you call me, sometimes it's unknown or blocked.
That's because I'm usually driving around, and I will not make contact tracing calls from my phone because it's my private phone. Yeah. And I'm not going to give the number out.
Right.
But I want it to come from someplace where someone says, okay, this is a kind of a real number. I mean, I had to talk to somebody in one of our towns. They got a mass COVID call. So they got a CTC call. And they looked at the number and they didn't believe it was real. So I'm on the phone with the person. I looked up CTC. She gave me the number that came through. I said, yes, that is the number that comes through. So, if you're getting a call from mass COVID, that's the Contact Tracing Collaborative. Please pick it up.
Jim, one thing that I don't know, speaking of the process of contact tracing, so epidemiologists have been talking about, like in other countries, they do some backward contact tracing. So they take the case and try to figure out where they got exposed from. And then, if it was a social gathering, say, and the case knows that they were at that social gathering, then they can try to take one step back and then see what other contacts and potential cases may have arisen from the same event. That probably works better with certain events, but than it does some other things. But do you guys do anything like that, or is it just starting with the case and going forward?
If we had the luxury of time, we'd probably do that. Would be the more interesting way to do that, just to try to. But it's really trying to move as fast forward as we can to try to limit the number of people who are out there who may be infectious or become infectious. So that's really what we're trying to do.
Yeah, and that's important. Absolutely. I'm wondering if we can embrace people being honest and open. If someone could say, "Hey, I was at this party and I have a case. Who can you guys should all get tested?" Something like that might help too.
I'm afraid that we may have some people who are almost understand the questions that are going to be asked and ask the way they think they need to. And that kind of stuff makes me nervous.
Okay.
One of the things the town may be able to do is also, because cell phones are so prevalent and people seem to carry them with them at all times, especially certain age groups, is that there are companies that will allow you to peruse their cell phone location data. So that is something that other countries have used for contact tracing, and very successfully. Because, in fact, the United States used it to do the Sturgis rally. They saw all the different people coming into Sturgis at the event, and then they saw all the people leave Sturgis at the event, and they were able to use that to successfully do contact tracing for certain individuals that were deemed positive and go out and do that. They did that also in the state of Florida for when they had the beach problems, spring break and things like that. They were able to, if somebody came down with COVID, they were able to look and see, yep, this person went to the airport and then this person got on the plane because the ping shows up here. So we need to go notify these other people that's there. So this is something that if it starts to become prevalent, this is something that Littleton could reach out and start to get some of that data.
It is a concern that people won't share information with Jim and the contact tracers, or will refuse to get tested because they're afraid of what that might mean for quarantine and isolation. It's a big concern for our community's health.
Well, also, their example, excuse me, there's an example of people just not being interested. There was an organization in DC where there was a major event, and it was basically a hotspot. I'm sure most of you heard about that case. So, I mean, it's even at some of the highest levels, it's being ignored.
Yeah.
Apparently, there's probably a more serious problem than Google. It's probably synaptic deficiency.
If I may ask Jim another question. Jim, when you talk to people, are people pretty okay with isolating, or do they need support? We haven't gone grocery shopping for 3 weeks. We do it like every 3 weeks at this point. So if you told me tomorrow that I need to isolate, I would need support to go get groceries. Are people prepared to find out they're exposed and need to isolate, or how does that work?
I guess I don't have enough. I've done some close contact calls, and so fortunately they've all been for kids and their parents can still get out and about. I know in the March-April timeframe, we were bumping into the ability to get resources, and we had actually asked a former outreach worker to come on and be able to kind of pull resources together so we could refer them to. I think CTC has a resource page too. So. Okay. But you're right. I mean, when SARS hit the last time, one of the reasons they kind of realized that Canada did it, or Toronto did a decent job at keeping 20,000 people in their homes, is they provided support. And that was a really important piece of making sure people would cooperate with the orders.
Yeah, I know there's only so much formal ways we can do that too, but even if neighbor can help neighbor situation, it would be awesome.
Reach out to each other. All right. Anything else from the CAT team?
In regards to testing, John might have some things to say.
Yep.
Sure. So we had a conversation with Lynn Snow, the Director of People Services. So Corey, Kevin Davis, and myself met with Lynn, and also Mary. Can't remember her last name, but she's the head of nursing for the district. And they mentioned the fact that they submitted a survey for a new program that DESE is trying to roll out for incorporating use of the Binax Now rapid antigen screen. And the idea here is that DESE purchased, I'm not sure, I forgot the exact number, but they purchased close to 1 million screens that it's going to be used throughout the state. And so they are going to try, the DESE is going to try and identify certain towns or school districts where they feel this could be, this rapid screening could be useful. And the first, I guess, target group that they would that would be tested are students that appear to be symptomatic when they're at school. So the idea would be for them to get tested and within 15 minutes confirm whether or not they have an active infection, and then go and get their the follow-up screen. So Lynn described that they expressed interest. Decision won't be made for another couple of weeks, and the program itself won't be rolling out until January. So that is something along the lines that we had proposed to the board, that would be something ideal because it's cost effective. It's not as expensive as a molecular based test, and it's something that can be done very quickly. You get a faster turnaround time as opposed to waiting for your qPCR results. So that's something that just came up. There's also the group and Kevin Baker met with Matt Nordhausen this afternoon or this morning to go over, I guess, the preparation of a slide deck that's going to be prepared for the select board meeting on Monday, and this is to discuss the idea of a screening strategy and the benefits of having something in place. And we're going to try and tie in the discussion that was with Lynn Snow from this morning to try and say that there's many stakeholders that would like to see a screening program put into place. And if this thing through this opportunity through DESE comes to fruition, then this might set up the infrastructure that the state will be paying for, and then to continue. The town would have, hopefully the town would be interested in continuing this on a more regular basis, once everything is set up through that DESE program.
I'm sorry, it's a little unclear to me. This seems to be like everything else the Commonwealth has done, and that's been reactive.
It is. So you can look at it in the sense of two ways. Prior to getting this notification from Lynn Snow about this, the DESE-based program, we were still proceeding to put together a slide deck to propose the idea of establishing a town or a town screening program for the teachers and students. But now that this has come on, now in light of the DESE program, we're still planning on proceeding forward to presenting to the select board the idea of having a screening program. But the added factor here is that DESE is offering to have a part of the program, or to cover part of the program. So this way, we can put into place the needed infrastructure to have this type of testing set up at either the schools or a separate location, and then the town would then have to pick up whatever costs afterwards if we want to, for maintaining the program, screening program.
Okay, so basically the idea is you're going where the money is. So the objective of this initially is basically to respond to folks who have symptoms.
Well, that's the DESE. That's the DESE.
That's correct. Correct.
Yes.
Right. So what you're saying is that your scenario seems to be that we would join in or try to become part of this program, benefit from it by using the funds either that they have access to in addition to what the town would contribute. So we'd establish an infrastructure for testing.
Well, so this is all rather new, new information for us based on what Lynn had provided.
For one second.
Sure.
So Mike, I think the idea here is to, try and, so this whole program, the webinar just happened this morning with the DESE and the state, and Jim, I had a conversation with him about it this morning, and he had just sort of learned about it, and we had a conversation about working out the kinks. But I think the idea is that we're presenting in front of the select board on Monday, and
under what blanket or what authority are you presenting this?
I think Joe Layden asked for a couple of members of the CAT team to do that in regards to testing and what might be the best route to do that. But let me get back to what I was saying, in that I think if we could put together our own plan to do it without DESI's help and their state program, and then if we get selected to be a part of that program, get that implemented on the back end, that might be the best way to go. I don't know.
Do other members have I mean,
Yeah.
it's not so much I'm confused. It seems like, you found an opening, which is great. It's just that I'm not sure what the opening accomplishes for the town other than establishing an infrastructure for testing. Because it sounds to me like if someone has the symptoms, they're going to get tested. It's not really surveillance.
I think you're moving closer to a step. I mean, I think it's a tool the schools can use for kids in the schools to try to make a decision. I just wish there was a little more coordination with DESI and DPH, because Mary Philpott, who's wonderful, sent me the first inkling of it, and then I sent it to the state and said, hey, how come we don't know about this at the health department? And they said, oh, we hadn't gotten there yet. And then I didn't even know about this presentation, but Mary, again, was nice enough to send the presentation to me so I could at least look through it. And I think the goal is for them to have another tool in the school.
Have another school, in other words, basically to respond to incidents or suspected incidents in the school. Is that the idea?
That's my quick read of that presentation.
Yes.
Okay. So if it's in the schools, my next question would be, just out of curiosity, have you engaged with the school committee?
We just learned about, sorry.
Yeah. What I'm getting at is that it's very nice that if you're going to present to the select board, and you're going to be aiming, shall we say, the concept of the schools. I'm not trying to throw bureaucracy out of there. It's just that you should go in there loaded for bear, as opposed to just walking in and saying, oh, we have this thing for the schools. I think it'd be useful to have a conversation before you go into the school, before you go in, and with the school committee, and let them know what's going on.
So, Mike, this request to present to the select board was on the behest of Matt Nordhausen. So he had requested. I understand the point of making this clear to the school committee, but I think the avenue that they were considering is bring this up to the select board so that they're aware of it, because at some point this needs to be financed. And I think we had discussed this before, who's going to pay for this. So this is where they felt it was the best approach to get this on their radar.
And Mike, I don't know if you and I are kind of on the same page. I agree. This is great information, and it's good to set this up. But Kevin, this should have gone through the board too. As I think that
Janet had emailed just asking who was available. I didn't know that. She didn't run it by you.
Yeah, this is. This has the potential for killing the whole. Yeah. Go ahead.
It's the process. Maybe Mr. Nordhaus should have asked the board to discuss it first before he had. The CAT team is our advisory too. And I'm not saying that I don't think that it's the right thing to do, but I don't want to get, maybe the CAT should be, the advisory to the select board in this issue instead of Board of Health through the select board. I don't know, Janet, am I wrong in saying
You're right.
how this order is going?
You're right.
All I know was that Joe asked for Kat's contact information, which I didn't have. I wasn't sure what the reasoning was.
Mm-hmm. All right. I'm not saying that I'm not saying no to any of it, but I think that the proper process should happen. So,
Lisa, if I could.
yeah, sure, Jim.
So, I think, to me, I think this is, again, a disconnect to executive branch departments. And I still don't understand why DPH doesn't kind of take the lead and then entities like DESE follow. DESE had this program they rolled out to the schools. And from our perspective as health agents, I found out about it from Department of Public Health after I found out about it from Mary Philpott. So I think this is moving at a state level that's not as coordinated as it might be nice for communities to have. If Department of Public Health says, hey, look at with DESE, we're providing this situation, I think that would be a lot more helpful so that boards of health at least had a sense of it. I think I understand what DESE is trying to do. I just think it's disjointed, unfortunately.
Well, at the local level, it could be even worse than that, because if we want to, whether it's from the Board of Health or a member of the select board who is, new to the field, I'll put it that way, it's very possible that you could gain a lot of traction if you made contact with Mike Fontanella, who's the chair of the school committee, directly, and indicate to him that what you understand is going on, and basically say if you're going to make a presentation to the select board, it has to be something that's very clear, okay? And that one of the first questions they may ask is, well, where's the school committee? What does the school committee, what does the staff, what does the administration think about this particular thing? They might say it's wonderful, and they can decide who will run it, what the process should be.
It's true. That's correct.
So at the bare minimum, I would suggest that, and I'm not trying to short circuit anything, I would suggest that you get on the phone immediately tomorrow and try to make contact with Mike Fontanella, who's the chair of the school committee, and let him know what you have in mind.
I believe Lynn Snow is on the school committee. She works for,
She's part of the administration. Like she's
No, I'm talking about someone who's the elected board. Okay. There's an elected board, because working through staff and all the rest is basically shooting in the wind.
I do feel like, Mike, we kind of get thrown in the middle of everyone wants to talk to us, and we don't know the politics part of it.
No, there's no politics here. It's
the
executive.
There is it may not be politics, but there is a process.
The process. Thank you. That's the word I really wanted to use.
Yeah.
So we are new to this. So
no, so are we. But I think Mike and Kevin and Jonathan getting in touch with Mike Fontanella would probably be the best. Like Mike said, I think that would be a good idea.
Yeah, I would not have, I wouldn't step into the Board of Selectmen meeting armed with what you've got at the moment.
Mm-hmm.
The other thing Matthew Nordhaus was interested in hearing was the health metrics and having that in front of the select board. So we can break it into two, or we can wait.
Yeah, my observation would be, it would be very nice to have the data that you are presenting, because it would scare the hell out of them, if nothing else.
Yep.
Yeah, I mean, I think.
Yeah, scare the hell out of them and tell them, oh, by the way, the school committee has some information on some information that Kevin and Jonathan have too. So.
Yeah.
But yeah, more information, Kevin and Jonathan, I think.
Yeah.
Before you.
Texting with Mike, we'll talk in a minute.
I didn't hear you.
Yeah.
Do you feel you need, I mean, to be perfectly blunt, do any of you have easy access to Mike Fontanella?
He's going to call me in like 5 minutes as soon as we're done with this meeting.
He is? Or you're going to?
Or should I invite him to the meeting right now?
Well, without him being advised and sort of briefed, I'm just hoping that
I totally
if you get him advised and briefed and tell him what you're going to have in mind, and he doesn't.
And get his opinion and see what he wants to do too.
Yeah. Janet, is it all right if I guess we're still in the COVID discussion. Can we have Mike join us?
Yeah, I don't see him in the attendees at this.
Kevin's going to text him.
Let me see if he's got a minute to jump on. I don't know.
Yep. Judy, you came back on. Is there something you want to talk about?
I just came on because I heard you were talking about putting slides on LCTV.
We'll get to that, I guess.
Okay. And then you guys, I just started talking about school committees. School committee meets tomorrow night. So if you don't get a hold of him now, 7:00 tomorrow, he'll be on a webinar.
He's tied up right now, actually. So.
Okay.
Um,
So do you think you'll still meet with select board on Monday or?
The metrics and
Metrics.
Yeah. Okay.
I mean, the I think the idea that Matthew had in regards to bringing this bringing the idea of the screening onto their radar is just to make them aware that, hey, there's a group that's looking into it. We're not looking to discuss specifics, but as we've discussed over the past couple of weeks, it's going to cost us significant. There's going to be some funds that are needed to finance this. So I think, in his view, bringing this to the light now so that they can start thinking about, all right, how would this be paid for and so forth. So there's really nothing in terms of like a specific company that was going to be done. And as Kevin had mentioned before, Lynn Snow approached us about this, so we just became aware of this, less than 12 hours ago. So,
What you're envisioning is what's the cost range?
oh, we're still trying to work through things. So we have, I think last week I presented or talked about the Quest Diagnostics proposal, which came out to be about $75 per person for the molecular-based approach. We're not settled on anything. We also talked about the Miramis pooled screening approach. So there's nothing set forth that we're proposing to the select board that or nothing we're recommending. We're just I think Matthew wants to shed light on here are the options that are being explored. Here's what's available, and that's pretty much it. So there's no request for any funding that's going to be coming out of Monday's meeting. It's just to make them aware that these are things that that should be considered based on the metrics that Katrina is going to present.
Yeah. And let them know that you guys haven't made any final decisions and that you still don't have all the information as.
Yeah, we don't have. I mean, it's not. Well, it's not our decision to make. It's not our decision. We're providing the information to the board and also to the school committee, but it's not our decision. We're just saying here's what's available.
I know, but you haven't made a commitment to anybody.
No.
Yeah, and let them know that that's the case.
The other thing I think Matthew is interested in letting the select board know about was the contact tracing app and whatever Kevin needs to kind of move that along on the state level. So that was also part of here's where we are with the metrics. And then these are some things that are moving and we could actually use some.
Yeah, but
I had a good conversation with Michael Hugo this evening, who's the head of the Governmental Affairs Department at the Massachusetts Association of Health Boards. And I think Kevin is going to give him a little bit more detail on the program. And I think he's got some folks at DPH. He's like on a call with DPH like every day, 3 times a day. So Kevin, I don't know if you want to speak to that.
I think you covered it pretty well. It's just the basic information that I've given this board and basically trying to advocate to get the state, whatever resource we can do to try to get the state to turn this on. Is essentially that's the reach out, right? It's like it's nothing more than basically having a conversation with them. It's not saying, hey, Littleton's going to give or Littleton's going to do this or anything like that. It's actually trying to do the influence and to say, hey, we really need this. If we had this technology, it's another tool that Jim could help Jim, to help the town. So there's a lot of those things. So just having this person go and try to see if there's some trees that they can shake to try to get this loose in the state, then this would be a good thing.
Yep.
Mike just signed on. Fontanella.
Mike's on. So Dave, can you add Mike Fontanella?
Hello.
Hi, Mike. Thanks for joining us. So we had a little bit of a discussion
You're
about, hello?
Yep.
We got you.
Kevin and Jonathan are going to be presenting some information to the select board on Monday, but we thought that school committee might want to get some of this information before that. So you guys want to explain to Mike what you guys were talking about in terms of testing?
Mike, did you hear about the DESI program that they're trying to roll out with the testing this morning? It was like 12 hours ago.
No, sorry. I'm recovering from yesterday.
I bet.
Working at the polls, so I have not done any of that.
Jonathan, I don't know if are you comfortable filling Mr.
Sure.
Hunt?
So Lynn Snow had mentioned to us that she submitted a survey to DESI, a program that's being sponsored by DESI and the Department of Health for taking part in the Binax Now rapid antigen test rollout. So I think the program is to provide select schools or school districts with this rapid antigen test, so that this will to be able to screen students that appear to be symptomatic, when they show up at school. And the thing here is that it's covered by DESI. So if Littleton is selected, they would be part of the program, given the kits, and that I believe, and Lynn is still trying to find out the details about this. The town would be required for setting up the infrastructure for setting up the screens at the school, and then the DESI would cover the cost for the test itself. So this was we were told this earlier today, and they're looking to pursue this. In regards to the select board, I guess presentation, we were asked by Matthew Nordhaus to just give an overview in terms of screening and sort of the rationale. Preceding this would be Katrina's update on the metrics, and then here, as a way to sort of mitigate any problems, our proposal of adapting some sort of screening program for both the teachers and students. The main emphasis would be as a surveillance program, but depending on how things go, that's the ultimate goal of what we would like to do with that approach.
Do you have any comments at all, Mike, or questions?
No, I mean, it sounds interesting. We can certainly have Lynn speak to it about it at our school committee meeting about the grant that she's applying for in the program, and what her expectations are for it, or what led her to decide that was something that was worth pursuing. So we can certainly get an update from that, and then we can certainly attend the Board of Selectmen meeting on Monday and contribute to that discussion if there is any at that point, to see. I mean, I think Jonathan raises some good points. One is, if we decide that there is an opportunity to implement some type of testing, that's one thing. And then the next question is, well, what's the scope? What's the goal? What's the reason for doing it? And there's different reasons why you might decide to do it. All of them valid in their own way. None of them, being exclusive to each other. But I think that there's a lot of discussion that would have to happen so that we understand. And I also think that would be interesting if we got farther down the road on this. I think our parents would certainly want to chime in with their own thoughts. And that's been a part of what we've been trying to do when we make decisions about how we're proceeding, is making sure that we give our families and the public an opportunity to weigh in and let us know what they think.
Agreed.
Okay. All right. Great. Well, good luck on Monday, guys. I'll tune in to 6 o'clock, right? All right. Thanks for joining us, Mike.
Yep. And we'll definitely have Lynn Snow speak about this tomorrow night at our school committee meeting. So if anybody wants to chime in on or dial in to listen to that. Okay.
All right. Thanks, Mike. Get
All
some
right.
rest.
Thank you, guys. All right.
Okay. So school committee on, what's tomorrow? Thursday, and select board on Monday.
And no Board of Health Wednesday because it's Veterans Day.
Yeah. But we're not done yet.
I know.
Okay. Is that it for the CAT team? Any questions or comments for them at all, guys? Again, doing a great job. Thank you for helping us.
Oh, I have a question. Do you plan in the same evening if that you're going to present the testing? Are you also going to go into the use of the cell phone app turn on?
Yes, I think they said they were. Yeah. Katrina's going to present. Kevin's
Okay.
going to put pressure on the state to turn on the app, and Jonathan's going to talk about the potential for testing. So,
Just a quick note, and that is one of the questions you're bound to get. In fact, if someone doesn't ask you, you probably should mention it. If there's any other state or, shall we say, city, anybody currently using the system to good effect, mention that.
The testing or the
No.
contact tracing?
Correct. The use of that technology, because it does have a reputation preceding it. There have been failures with it.
what the tracing or the testing, Mike?
No, the tracing, the use of the cell phone.
Hmm.
And it's
Yeah.
nothing with Google or Apple or the technology. It has to do with the way people are.
Yeah. There was some studies internationally in the UK and in Europe where when they did the initial rollout, the sales pitch, shall we say, wasn't exactly correct, and so there was a lot of resistance to actually rolling it out and using it. Same kind of things happened, but when Switzerland did their rollout, they did it right. They used the Google Apple API, and they have a very large percentage of the people actually using the app. So that's at adopting it. In the United States itself, Virginia was the first one, and they've had a rather successful adoption of it. Several other states have started to do it. College campuses, some college campuses have done the rollout and have been successful with that technology. Washington University is probably one of the biggest ones that has a lot of this and is in use. They're actually in conjunction with Canada on developing their app. And they're working with Vancouver University as well. So there's a lot of traction that's out there and a lot of goodness. So far, Mike, a scientific peer-reviewed study showing the effectiveness of it has not been put out there in the wild yet, but I'm guessing something probably around the beginning of the year or so will show, how effective some of these apps are. I mean, the state of New York just turned theirs on, is turning theirs on in the next week or so. So it's new stuff.
No, I'm just saying for you to be prepared, and it's. I know a little bit about this. I'm just simply it's basically when you make the presentation, make it clear that we're not being asked here to invent the wheel. The wheel has already been invented. That's the take-home message.
Fair enough. Okay, I'll make sure that message is in there. Thank you.
Yep.
All right. Anybody else? Questions, comments? Great. All right. Thanks very much. Thank you, Jonathan, Kevin, and Katrina.
Thanks, Jonathan.
Lisa,
All right.
Lisa, if I can just ask
Yeah.
a quick question. We won't have a Board of Health quorum at either school committee tomorrow night or the select board on Monday. Is that correct? I just want to make sure we're not.
I was going to make sure that I was there.
This is tomorrow night, right?
Yeah.
Yes, because I don't have time to make an agenda definitely for tomorrow night, but if you're going to have a quorum for Monday, then I need to know that.
Kevin, you're going to.
I'm flexible, whatever you guys need me to do.
Well, Kevin, you're going to be there to help present, right?
Yeah, I'll be there on,
Tomorrow night too.
well, Katrina's just presenting her wonderful metric presentation tomorrow night. I typically am not on the school committee meetings, but I was planning to be there Monday at the select board meeting.
So you're just going to rely on the woman that Mike Fontanella mentioned, rely on her to present that?
Yeah, she's really heading that piece of it up. She's the one who applied for the
Our night. I want to be there the whole night because their meetings are getting so
I'll
long.
be on the call if you need me to speak to something, because my wife's definitely going to be listening to it, so I'll be there. Let me know if you need me to say something, but
Oh,
I
so no.
don't know if it'd be appropriate.
So I'll try and be there at both meetings. And Kevin, I think you and I on Monday with the select board.
Sure thing.
Does that sound okay, Janet? You guys okay with that?
Can we attend as the public, not as a board member, Janet?
Yeah, of course.
Mm-hmm.
Yeah, I think that once I see in person, if there's 3 of you in the room, you can't.
Right.
So
Yeah.
I don't think you can have 3 of you on Zoom.
That's funny.
You can watch it on television.
Yeah.
You just can't be on the Zoom.
Okay.
As a panelist, or could you be an attendee?
Well, you can't be an attendee in the room when it's a physical room. Let me see, Kirby's. Yes, so Kirby's sending me, no, you cannot just show up. So no, you cannot. You cannot be on the Zoom. So you can watch it on television, but you can't. We can only have 2 of you there tomorrow.
Okay.
If there's going to be more than 2 of you on Monday, I'll speak with Joe and make it a joint meeting because I have time for that. But we don't have time for tomorrow.
Mike, don't you want to be there Monday? No.
Of course he does.
The short answer, yeah, I could be there. I just want to be very careful that the pathway for this is I'm glad that we had Mike Fontanella here because we'll get a better read after the school committee meeting last night of the half-life of the approach. Okay.
Mm-hmm.
It's extremely, for me, it's an extreme, to be very careful when you're dealing with the select board because of their multiple, shall we say, roles, which are both political and executive at the same time, and sometimes very political. And I'm very concerned about a very good approach or idea that most of us here believe the town believes in, or the town needs, one way or the other. I just don't want to see reasons for people to jump in and say, no, we shouldn't do it, for what they hear from a hastily put together concept.
Mm-hmm.
The metrics are something else. I think that anyone with their head screwed on right will get, understand very clearly. They'll get scared.
Yeah.
Okay, so I would be very happy with that by itself. But that's me. But I think it's good that Mike Fontanella heard it, and I'm hoping that if they make it to the select board unscathed, that it'll be listened to and taken seriously. So I plan to be there Monday night to short answer your question.
Short answer.
Yeah.
Right.
Unless of course I can become part of one of Katrina's graphs.
No.
Hey,
we don't want that, Mike.
it can happen anytime.
Yeah.
Yes.
Don't.
Okay. So going back, guys, so only 2 people can be at a meeting, Janet? I'll be at school committee tomorrow. Does anybody else want to join me?
I'll be in attendance, so am I not?
Okay. Okay. And then can we add the rest of the board for the have time to add anybody who wants to the select board meeting, Janet? If anybody else wants.
I'll talk with Joe tomorrow and try and get the board in as a joint.
I'll be there. Kevin, you'll probably be there.
Yes.
Select board. And Louise, are you interested?
Yeah. And Mike.
Yeah, I'll be there.
Okay. Yeah. So, and Gino, do you think you want to be there at the select board meeting on Monday?
Sure.
Okay. So yeah, again, Janet, I think we'd all like to be involved in that.
Okay.
So, all right. Great. So I think we're done with the COVID update. Correspondence, member comments, public comments. Does anybody have any correspondence at all that they want to talk about? I think
we already talked about it, didn't we?
Time to fill member comments. Mike was kind enough to write, what would you call this, Mike? Manifesto?
No. It was just, it was intended just as if you needed something to add quickly to the deck, which I like the graphics. I like, the whole 9 yards of it. And if you needed a phraser here, it was just stuff that you could just copy if you ever wanted to use it.
So we charged Janet with trying to find out if we could get any funding for mailings. And I know she did a lot of work trying to find that out. And I don't know exactly what you found out, Janet.
So Cheryl said, Cheryl, I'm not going to remember her last name. She's the finance.
Oh, yeah.
I think. Yeah. Said we might be able to get some funds from the CARE Act if we respond. I think it's November 15th. I would have to get her specifics, what it is you're going to be mailing and when. I was not clear on what it is you were planning. We had been talking about this before Halloween, and I wasn't really sure what it was you wanted to mail, since things are so fluid that by the time it gets in the mail, it may be old news by then.
Halloween was so fluid, and I think it was less than a week between the time that we talked about this and the time that we voted for the trick or treat. Right. So whether it be in a mailer, just again reminding people, and like you said, like praising people for what they have been doing, but that we still need to be vigilant and understand things. So is that all right if we try and get this out to people? Did you guys read the letter by any chance?
What letter?
I didn't see a letter.
Not really a letter. I guess it's a warning, really.
About the competition that Louise presented, how Littleton can be the best town COVID-wise.
Maybe we should put go around town, take pictures of people with masks on, and put it on the website. Hey, look at this! Here's someone with a mask on, or something like positive reinforcement.
But I want to go back to this thing that Mike wrote, and I can read it to you if you guys want.
Wait. Before you read it was not intended to be a piece that Janet and you had circulated what looked to me like a slide collection with graphics in it. I think that the what do you call it? The fire chief checked it out.
He had some good ones too.
Okay. So I thought that pretty well, from a public relations point of view, nailed it. I think that communicated not only what the governor wanted to do and what we were trying to accomplish.
The slides.
The slides.
Okay.
So basically it's those graphics and the accompanying text. And I thought just in case you wanted to, you needed more material to
Okay.
go around it, this would be, you
Okay.
can pluck stuff out.
Sure.
I do have a question though for Janet, because it is my understanding that the town owns and has and maintains an email index of residents of the town. Right, Janet?
I am unaware of that.
Gotta be though.
All right.
Gotta be.
Janet, this goes back a couple of weeks where that was mentioned along with, shall we say, trying to time it with mailings or even using the system that the electric light and water uses when they put out their, shall we say, their propaganda, okay, which when they send out their bills. Okay. So if we're going to get funds, the whole idea of having to go through a granting program as opposed for the town makes no sense to me whatsoever. I mean, we're in the red. And I mean, we have a situation in which we'd like to get the word out, and basically is that masks, stay away from people, use good hygiene, except it's got to be shouted from a high, make it very, very clear that we have to get to as many people as possible in the shortest period of time, hopefully before Thanksgiving. So as far as I'm concerned, the business about, applying for money from the CARE thing, and here's the deadline. I think there's been a failure to represent what's going on here. So my question is that is there a mailing email list that could be used, or a mailing list that the town uses?
And I was told that that there is a mailing list, and roughly postage for postcards is $800 to $1,000 to mail to everybody. And as I said in the email to you folks, I wasn't sure whether you were looking at postcards or letters or what it was you were looking. Nobody at all mentioned anything about a mass email address.
All right. But sending emails wouldn't cost us anything, correct?
Yes,
Except administrative time, if you want to call it that. All right.
So we also talked a little bit about maybe getting Alicia involved. I know I'm jumping around. So I was thinking that listening to the presentation, that Thanksgiving slide, what to do about Thanksgiving, would be a really good thing for us to get onto LC.gov news stay-at-home advisory, and the mass.gov news Thanksgiving during COVID-19 would be also good websites to get up for people to see, whether it be in a mailing or whether it be on TV.
So the mailing would be basically letter size, not postcard, a letter.
I don't know what could fit on a postcard, and I think if we can do an email, then we can get any kind of information to them.
Yeah. Okay.
Better return on the email.
Okay. So it's going to be either, does such an email list exist, or is everything done by mail? And if we're talking about $1,000, gee, I'll make sure I show up on Monday night and follow up, or we should follow up after Katrina makes her presentation. We make it clear to the select board that we're looking at a serious problem here in town. And what we're looking for is $1,000 to basically let the town know what measures individuals and families should take to protect themselves.
And also, I think it might be really worthwhile for us to get in touch with there's a new person, I think is it Ashley Shaheen over at the Elder Human Services, to give folks a sense of, hey, if I have to quarantine or I have to isolate, here are some services. If I can't run out and get groceries right now, here's how I can get that done.
Even going back one step, Kevin, I have notes for just like what isolation and what quarantine guidelines are, so, and how you need to do that. So
And just one last thing is, I really, really think we should take a good, strong look at getting some sort of, and I hate to say it, but like a Facebook page up there, because there's so much information that we could be putting up there, files, attachments, documents, just that people could reference and also be able to spread the word at the same time. And I know we've got opposition to this, and town hall doesn't like it, but I really do think it would be effective.
Littleton COVID-19 Facebook page.
Anything.
Yeah.
You name it, whatever you want to call it.
All right. Judy, Janet, do you guys have any suggestions at all?
Well, of course.
There's our local LCTV queen.
So Kevin is kind of right about the Facebook and the social media. A lot of people are just getting their news from social media. So I'm not really sure about town hall rules or stuff about putting up a new Facebook page from Board of Health or whatever. Whatever, like you said, whatever you're going to call it. But I have found that the most traction that we get from YouTube to our video on demand site, to our Facebook, to our Twitter, is any videos that we put up on Facebook or the stuff that we send people to YouTube for. That's, that gets you a lot of traction there. There's a reverse 911 if it's really, really bad. I know that people have been able to go to the town website and sign up for townwide alerts. So there's got to be some sort of distribution list going on somewhere, because I know I get all of the, as a resident, I get the emails sent to me when there's new agendas coming out and other stuff happening in town. So there's something already in place.
I don't get
Who
those.
signed up for it though. So that's not going to get everybody in town. That's only going to get to people who have actually
It's an opt-in.
signed up for specific alerts.
Right. So there's things that are out there and available to you. It's just trying to figure out what they are.
We could definitely get the word out to get people to opt in if that's the way we need to go.
Exactly.
I didn't know about that.
Yeah, it's I can't remember what it's called off the top of my head. I'm sorry, but there is a way for you to opt in to get emails, and you can say if it's just like the big alerts or if it's minor stuff. And then the town's websites are there, but you got to somehow drive people to them. People aren't going to go and check regularly. They're going to be driven. To be honest, so school committee meetings. I go, oh, it's Thursday, it's school committee. I'm going to go Thursday. I'm going to go look for the metrics today. Right? Like, I don't go normally as a person, I don't go normally out to the mass.gov COVID site to get those metrics, but I remember school committee metrics. So if you can find something that grabs people to be able to have them have that association to go out and get it, but otherwise you got to push it to people. That's my 2 cents. LCTV, social media, and reverse 911 would be kind of my suggestions.
So this is Kevin Davis. I was just going to let you guys know that the LCTV that isn't on people's streaming platforms. So the fact that you've got things on YouTube and all those other social media sort of kind of directing them to YouTube is actually more valuable than the LCTV. I mean, I know you can go there, it has a website and you can go stream data off of it and all that kind of good stuff. But having it on YouTube is actually really way cool, awesome.
Yeah.
Because people like myself who actually don't have cable in their house.
Right.
That's how I actually subscribe to LCTV's YouTube channel, and every time you post something new, I go and I watch it. So the more that we would actually post to YouTube, I think, from my only individual perspective, that would be more beneficial than, yet another website that Kevin has to go monitor.
You're right.
That's great input. Thank you. Because we run the bulletin board slides in between every program on the channel itself, which also streams live on the video on demand site that you could go to. I had started creating videos out of them and putting them up weekly, and I hadn't gotten any feedback that anybody was watching them, so I stopped. So now that I know that when we send something to YouTube, you get the notification and you'll watch it.
Yeah, one of the things you guys ought to do as you know, one of the things you need to do is like and subscribe. You know, you need to actually get on there as a little talking head and say like and subscribe. You know, have little arrows pointing down to subscribe to it. And,
Mash that like button.
yeah, you know, exactly. You know, you need to get your content thing, and then what would be really great. You can't do it because you're a government organization, but if you could set up ads that run on the bottom, and you could get a source of revenue in for, you know, putting stuff up. So,
believe it or not, we've talked about it. It's difficult because we are a municipal, part of the municipality instead of a
right.
nonprofit.
Yeah, exactly. So, but yeah, it's a very positive thing for putting those things up there, because it's easier for me. It just comes across I'm like, oh, look at that! I got a video to go watch. Okay, and I can fast forward through it, do whatever I need to do, and get to the interesting parts.
So do the PSAs get up there, Judy?
Yes.
Okay, good.
Yeah, I'm the one that puts them up there. So yes, and you guys can create them. We can do them right through Zoom. We can create any PSAs that you want. I shouldn't say any, but if you guys want to create a PSA and put it out there, we can do that. We have. Let me rephrase that. Kirby has mastered the art of how to do a PSA through Zoom.
So one of the more interesting things, I'll see if I can find it. I'm not advocating people load TikTok, but I will say that there are some, not in the Massachusetts area, but in another state that will remain nameless, that their cities are starting to put up things where they are actually, doing PSAs across that reach those specific locales, and they are being extremely influential. So,
and that's an age group it's really hard to get information to, so it's not a bad idea.
yeah, and I'm not advocating, putting that app on everybody's phone, because talk about surveillance. It would be interesting to, get something like that. The other thing would be Twitch, which, other things. I know Mike Zeldin, I see. I'm sorry, but
no, it's all right. No, I belong to a club called What Do We Hack Tonight?
So in other news of things we already have access to, and we just maybe need to find the channels of people who could help. Like if you go to if I can share my screen real quick, if you go to the website, the town website,
you got the big COVID thing in the middle now.
You can. So if you're in Littleton,
this is what we were talking about,
which is right on the front page. There's a Board of Health urgent alert that gets an email out. You can opt in to get emails from various things, like anyone who wants to send a notice. Basically, I'm not sure who sends it or who's in charge of it at town hall, but or how that goes through. But there's a lot of, you can get meeting agendas, or urgent alerts for the Board of Health might be okay right now for there to be an email blast, for example. And then I just looked at the Facebook page. Town of Littleton, Massachusetts has a Facebook page, which I don't have my screen share, but there's 1,000 people already signed up to get notices. And there was just recently things on voting and no trick-or-treating and things like that. So whomever is maintaining this page, if you guys could feed information to it, you already have 1,000 people sitting here who will get the notice.
That's the town's Facebook page, right?
Yep, Town of Littleton, Massachusetts Facebook page.
Okay.
Facebook or website?
Facebook.
I was just thinking, Janet, do you happen to know who runs that Facebook page for the town?
Hold on, I'll look up the admin.
I do not. When we approached IT about it last year, I was told the select board was not allowing individual boards to have Facebook time. So
we just roll over them. Let's just see what we can do.
Well, funny because you've got the You've got the, what is that? The
Park and Rec has their own.
Parks and Rec has one. Littleton itself
I'm
has
just separate though.
Park and Rec is considered enterprise.
Yeah,
okay.
That's why they go around, charging $60 a day to watch somebody. They're an extension of the prison system.
So if you would like to meet offline, and any number of you, we're definitely willing to meet. I know
Strategize.
I'm getting tons of text messages from multiple people at the moment with different suggestions on how to strategize and what PSAs to get out there and which email blasts to use. And, the C is community television, but we are all about communication as well. So,
Katrina, who is the admin on that page?
So it doesn't actually say a specific person. It does just say there's a Littleton.
there are at least 3 people that help run.
Yeah, there's 3, but it's not showing me right now.
Judy knows. She'll tell us offline.
Yes, exactly.
I think we can make the case with the Board of Selectmen that if they know who is going to be looking at our stuff before it goes on to the town, Facebook page, that's really all they want to know. They want to have a feeling of control.
It would be a really great way to get information out because then it would instantly be shared for all of the pages where people are hanging out.
Yep.
And LCTV, I've seen yours posted, some of the slide things that are coming up on Facebook. So they're out there. I just don't know who's paying attention to LCTV versus other sites.
There's a lot of times where we forward it so that it gets forwarded around to other.
And sponsor them. There's a lot of stuff we can do to get the word out.
So should I contact them with on the Facebook page? It says contact us. You think I should contact them and tell them that we're interested in using their site for a blast?
There's an email attached to it.
Littleton
If you go to about. Hold on, I just went off the page.
LittletonMAFacebook@gmail.com is the email, but that
doesn't seem official.
Yeah.
And Kevin already knows who owns that address.
Seriously, if you want to appoint a couple people to talk offline, we can move this along and definitely get you some stuff that goes out there.
All right. So
Sounds like Judy knows.
Jim did a PSA earlier in. Been doing another one.
We missed it.
What?
Yeah, you froze out.
Jim Greffy did a PSA earlier in front of a fire. Was it in front of the fire station, Jim?
I saw that back in March.
Yeah. Would you be interested in joining us and doing another one too, Jim?
Not anytime soon.
Oh, that's because he's part of the Actors Guild.
We need to get paid.
No, I'm just trying to catch up with the work I have. That's all.
Okay. All right. All that stuff sounds great. I'm just totally don't know what Twitch is, and I don't do Twitter. And Kevin, is that something? Are you too busy with that?
I don't do that Twitch.
No. I am busy. That is.
I meant Kevin Baker.
Oh, okay.
Are you too busy with Jonathan? I have no.
He's frozen again.
Yeah.
Oh, all right. So I'll call Judy. Judy, can I talk to you tomorrow?
Yes.
At lunchtime between 1 and 2. See what we can do.
2:00 would be great.
All right.
Oh, you said between 1 and 2?
That's when I have lunch.
Yeah, I'll try to move what I have.
I can talk to you after 5 if you want, but before 6. Before the school committee meeting?
Before the school committee meeting. That would be great.
All right. I'll try calling you. Do I have your number?
I'll send it to you.
Okay. Awesome.
You don't want to say it right now?
A lot of people have it, but no thanks.
All right. So no mailing right now.
If we can leverage social
Sounds like we don't need it.
for a fraction of the price,
Yeah.
as long as we can get that stuff activated.
And
So the other question is who are we missing if we're
right?
There's not everyone's on social, so I would be.
I'm not on Twitter.
Maybe there's some people here who could help with that. So
if you meet with Ashley and try to get into the broadcaster that gets mailed out to everybody, you add it into the broadcaster. I don't know how often that goes out. I think it's a monthly publication.
Monthly. It
Gino,
just came out.
Gino, what do you think about working with Ashley to try and get some of these PSAs out?
I don't know.
Do you know Ashley, right? Ashley Shaheen, right?
And do we want to talk about what we want going out?
Well, yeah.
Do you want to do that tonight, or do we want to find out, kind of fine tune what how we're gonna do this, and then decide what we want to do?
All right, you gotta.
I think
The other, just where you could get things in, I've had a conversation with Mike Fontanella about this and the schools. So the Friday newsletters to the principals, you could have a weekly information thing. The nurse has something every week now in the newsletters, the school nurses. So if you could put together a PDF of something that you want to share that week, and it could go out to the school population, the parents.
That hits a lot of people.
It hits a lot of people, and then it gets shared on social media.
Yeah. So
What
I thought
about,
yeah,
The
I'm
whole
sorry.
Thanksgiving thing, your Thanksgiving
Yeah,
plan should
that
be on there.
Thanksgiving thing that you have,
Yeah.
Lisa, that would be, that would be fantastic.
And then there's the website too about Thanksgiving during COVID.
It froze again.
Yeah, she's freezing.
Just a minute.
It's 9:30. Everyone's tired.
Exactly.
The Thanksgiving during COVID, Katrina website, is that pretty much just like what your slide showed?
It is a very dry read of what my slide showed. So the slide actually has the website listed if people wanted more information.
Do you guys think that maybe once a week we change, if send out whatever we're sending out, whether it be, on the emails or mailings, just change it to a different, like we talked about isolation versus quarantine, Thanksgiving, the new stay-at-home order. There's all kinds of, although they change.
It froze again.
Sorry, it might be a good idea to change the topic weekly.
And in terms of the school newsletters, they're often long, so you have to make them colorful so people pay attention.
And there is actually, I went and found the CTC people actually already have publicly releasable, publicly approved PSAs. So not only in digital format, but also in print format. So something that you could include in a newsletter is like, hey, if you see this number, make sure you pick it up, or if, maintain this and do that. So they actually already have a whole bunch of resources to take a look at for contact tracing.
Cool.
And the state has stuff too, like that, some videos and things you could link every week on the DPH.
DPH has a great YouTube channel as well.
Okay.
Right.
And Twitter feed.
Twitter feed. And Mass Governor has a great YouTube channel.
Oh my goodness.
From
Who
them.
has time to do all these things?
Well,
Millennials.
the fun thing is that you can go to there's sites that you can go to that you put one message together that then broadcasts it out to all of your sites. So that way you just get accounts into all of these things, and then you just do one broadcast and it goes everywhere. And granted, it is dollars, but there are ways to do this.
It would be awesome if we could figure out who in town is already doing this kind of stuff and who could help with this kind of communication messaging piece. There are people in town who do it. So if someone else wants to add to the cat, we could use an expert in communication.
Most of the good
Judy?
ones want to be paid.
Judy.
Judy.
Who's that?
It's you. No, you're definitely a good asset to have in this.
Judy knows the person that you're talking about. She'll tell us tomorrow.
Anything else anybody has to add? Member comments? And do we have any public comments? Anybody still there, Janet?
No hands up. Yeah, we still have 3 people, but no hands are raised.
All right. you guys ready to adjourn?
Make
I'll
a
make a
motion.
motion to adjourn.
I bet you. I bet you.
Gino, you can second it.
Oh, no. Always I have to be nice to the ladies. Can I win once in a while?
No,
Made the motion before she said it. Okay?
no.
About winning, Gino.
I still
Do I have a
love you
second?
though.
Do we have a second?
I'll second it.
Thanks, Mike. We'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino,
You know, yes.
Louise,
Louise Nichols, yes.
Mike,
Smile, will you?
and Lisa Flanagan,
Don't be
yes.
so bad.
All right, thank you, everybody.
Thank you.